Hello everyone, welcome to PHTV Channel 4 in Palos Heights. I'm Sue Jankowski and we are around Palos with Diane Ducey. Diane is she's here today because she's really, every year comes to us and she has just got so much information about Medicare, and it's that time of year we talk to her about Medicare. She comes to us from Ducey Insurance Services. You can actually look for DuceyInsuranceServices.com if you would like some more information. But we're really glad to have you here again, Diane.
Thank you, Sue. Happy to be here.
Yeah. Well, once a year for sure, if not, a little more now and then, we like to invite Diane here because, as we all now know, this is the time of year where Medicare you can add on or change or whatever. There's only a certain time span for that. And we were just discussing before the show started how confusing the advertisements can be about all the Medicare plans. And I think if you've gone to any Medicare website and looked, that can be confusing too. There's so much information. So Diane is going to kind of hopefully give us a little bit more information that makes it easier for you to navigate what you want or need in Medicare. So originally, I saw Diane and I asked her about Plan F, which they said was going away. So I was like, oh my goodness, I think we have Plan F. That's not good that it's going away. What are we going to do? And so that was my first question for Diane. So Diane, talk about Medicare Plan F, and is that really going away? Because all the people who have that are now thinking they have to switch to something else.
Okay, thank you for bringing that up. I do appreciate it. So Plan F, Medicare Supplement Plan F, for people who don't know, that works with Original Medicare A and B. And Plan F, as many of the supplements, they're designed to work with Original Medicare. And Plan F covers all of the deductibles, co-payments, co-insurance, and even what is known as an excess charge that Medicare A and B leave you to pay. So many people for many years bought Plan F. So Plan F is not going away for you, Sue. You have Plan F, that's great. The only people that are really affected are those people new to Medicare January 1st of 2020 and beyond. Anybody who is eligible for Medicare prior to January 1st can certainly buy Plan F. They can keep Plan F if that's what they wish to do. However, there has been so much talk about it, and then of course people hear something and then they get scared. They don't need to be afraid. I won't be on Medicare yet for a couple more years, but I'm not worried about not being able to buy Plan F, you see, because many people buy what is known as Plan G. So on the Medicare supplement, you have 10 different ones that you can choose, but most people usually choose Plan F or Plan G. And you may wonder, well, how come people aren't always talking about Plan G so many years ago? Well, that's because in 1992 is when the supplements came out, right? And so then Plan F was the most comprehensive plan and people were buying it up and everything. And then in 2010, the government tweaked Plan G a little bit and they made it better. They enhanced it. How did they enhance it? They cover the excess charges on Plan G just like on Plan F. So Plan G, very similar to Plan F, there's only one benefit difference, and that is Plan G does not cover the Medicare Part B deductible. Now the Medicare Part B deductible this year is $185, which is really relatively low, and it's a one-time calendar year deductible. So the only benefit difference between Plan F as in full and G as in good is that Plan G, you're responsible for the Part B deductible. So when a person is shopping for a Medicare supplement and they're looking at price, because a Plan F is Plan F is Plan F and Plan G is Plan G is Plan G with any company, but when they're looking at price with a certain company, if there is enough of a difference, and there usually is, between Plan F and Plan G with that company, that if I were to buy Plan G, I would save at least $185 over the course of the calendar year to pick up that Part B deductible out of my own pocket.
Which you may never need that deductible, so you might be ahead with Plan G.
Well, might is a very good word, because with The Part B deductible, because Medicare Part B covers physician charges and tests and x-rays and blood and labs and that sort of thing. So that part of Medicare we do tend to use more often than Part A, because Medicare Part A is hospital and skilled nursing facility, very important, but we're not routinely running to the hospital as some people may go to the doctor every few months. So it is true, some people may not incur the Part B deductible, but more than likely they probably will.
Okay.
However, the savings on the premium for the Plan G over Plan F is usually enough to cover that Part B deductible anyway.
Okay, so it's kind of just a lateral. So why is that? Why did they make that change?
It's such a good question. So why did they say,
Right.
okay, we're not going to offer Plan F any longer? Well, what's so funny is under the Medicare supplement plans, there's a supplement plan C, which used to be really popular, but has not been popular for quite a few years, simply because it's a little different than F. But that one's not going to be available either. But no one talks about that.
Oh no, because nobody liked it, I guess.
And then there's Plan F, of course, the one that's not going to be available January 1st of 2020 for people new to Medicare. And then there's Plan F high deductible, which is Plan F but with a deductible of $2,300. So those three plans will no longer be available to newly eligible Medicare beneficiaries January 1st and beyond. And the reason is because the government had decided, well, people don't have to have that coverage for the Part B deductible because it's so relatively low, right? And that can change every year. The highest it's been is $185. However, that's their decision.
Yeah.
That we're not going to offer plans anymore that cover the Part B deductible, and so that's why they did it.
Okay, they can just do what they want. So.
Yeah, I mean, it takes quite a lot of work in order for those changes to be implemented. But however, that's what they decided to do.
Okay, all right. So in other words, don't be nervous about it. You can keep it if you have it. If you don't have it, Plan G sounds fine.
Yes, I actually, for many years now, Plan G has been just as popular, if not more so, than Plan F. Because people look at numbers.
Yeah.
And if I can save $30 a month by going with Plan G, 30 times 12 is $360.
Yep.
If my deductible is $185 and now I have to pay for it, I'm still money ahead.
Right.
Right.
Yes.
Yeah.
Okay.
So Plan F or Plan G, you cannot go wrong with either of those plans.
Oh, good. Oh, good. Okay, so no worries with that. Good. Okay, so now the open enrollment period. That's what I was trying to say earlier. This time of the year is the open enrollment period. So for people who are unfamiliar with Medicare, or if someone is about to enter the Medicare system, what exactly does that even mean?
Okay, so what does the Medicare open enrollment period mean? So it's a period of time, October 15th through December 7th, where a person can change their Medicare prescription drug plan, or if they're in a Medicare Advantage plan, they can change that. Or they can enroll for the first time in either of those items if that's what they wish to do. The one thing that is most confusing for people on Medicare about the Medicare open enrollment is they think they can change their Medicare supplement. The Medicare open enrollment from October 15th through December 7th has nothing to do with Medicare supplements at all. If a person wants to change their Medicare supplement, they can do so at any time with their insurance company as long as they qualify. Because some insurance companies may ask medical questions before that person wants to make a change. But this open enrollment period, that's basically 7 weeks right now, that's about prescription drug plans and Medicare Advantage plans.
Oh, okay. So really, that's just very limited. I mean, as long as you can change your other supplement any time of year.
Well, any time of the year, as long as you qualify to do so medically.
Okay. Yeah, you can't just change. You might have the one that you have for an extended period of time due to health issues.
Well, right, and many people are just so satisfied with their Medicare supplement that they never desire to change.
No, right. Well, and I think a lot of people spend so much time choosing as well as they can for what they know, that they're pretty satisfied after all their challenges of choosing correctly. And so they don't change after a bit.
I agree with you, Sue. So what I always like to say is when people are making these decisions, when they're first turning 65 or when they're first leaving their employer, if they worked beyond the age of 65, educating themselves or talking with people about, their options and making an informed decision is always the best consumer, because they will be more satisfied with their choices.
Right, and
Simply,
no
yeah.
bad surprises. I mean, that's the thing too. Some people, in fact, I do know a few people who chose something on an economical basis, which of course you want to do too, but then they got some big surprises when it came to coverage of certain things that they really had to pay a lot more out of pocket than they actually realized, and that was unfortunate for them.
Yes, so when a person is looking at their Medicare options, do they want a Medicare supplement that works with the original Medicare, giving them freedom of choice to use any Medicare approved provider in the country? They will pay a premium every month to their insurance company, but then that supplement will help them with their costs. So
Right.
they sort of know what their costs are, their premium every month, and if they have a Part B deductible to meet, but however, they know they're not going to be hit with thousands and thousands of dollars. So when a person's looking at their Medicare options, they do have choices, right? They can go with original Medicare and a Medicare supplement, or they could go with what is known as Medicare Part C, not to be confused with Medicare Supplement Plan C, because it's sort of funny that they alphabetize them all.
Yes, it
But
is.
Medicare Part C is a Medicare Advantage plan, and that's an alternative way of receiving your Medicare coverage. So if I enroll in a Medicare Advantage plan and choose to receive my Medicare coverage that way, I'll be choosing it from an insurance company who has been authorized by Medicare to provide me with my Medicare coverage. So if I enroll in a Medicare Advantage plan, I won't show my red, white, and blue Medicare card any longer. I will show the card issued to me from the company that I chose.
Okay.
So Medicare Advantage plans, an alternative way of receiving my Medicare coverage, available through many insurance companies authorized by Medicare. So what I need to be aware of when I'm enrolling in a Medicare Advantage plan, I could have a very low premium, Sue, sometimes $0 a month, which certainly sounds attractive.
It really does,
right? Oh,
yeah.
it's like,
$0,
it's
that's
$0 a
good.
month. But then I need to be aware, because this does work for people as long as they are aware of what they need to do. They should use doctors that are in the network. If it's an HMO plan, they need to use doctors in the network. They'll need to choose a primary care physician, and they'll get referrals to specialists when they need them. And their costs will depend on which services they have and how often they have them throughout the year, because there's usually a co-payment attached to every service or every office visit or every hospital stay, inpatient skilled nursing facility stay, and that's what people need to look at when they're looking at a Medicare Advantage plan, so they don't have unpleasant surprises. If they know that it's going to be this many dollars if I go into the hospital for X amount of days, then they won't be unpleasantly surprised, right? So with a Medicare Advantage plan, your monthly premium may be lower than that of a Medicare supplement, but you will have costs for your services when you receive them, and those costs vary among all of the plans. One thing about a Medicare Advantage plan is they all have a maximum out of pocket, meaning if I have a year and I'm on a Medicare Advantage plan and I have co-payments to go to the doctor, and then I have to go into the hospital and I have co-payments, and I have co-payments when I go to skilled nursing, and maybe someone needs radiation or chemotherapy, and then I've got maybe 20% to cover, there's a maximum out of pocket on all Medicare Advantage plans. That varies among all of the plans.
Oh.
Right. So what you need to do a little homework, right? So when people tell me, well, I'm looking at a Medicare Advantage plan, well, then you want to find out, are your doctors associated with that plan?
And I think that's really so important to most people. They want the doctor that they've been with all along or they're comfortable with. But then there are people who are like, well, I don't really care. I like my doctor, but I can like a new doctor.
You are exactly right, Sue. So some people are very open, saying, I can choose any primary care physician out of this group, fine. So then do you want an HMO, which can be more restrictive, but sometimes can offer some extra benefits, right? Or do you want a PPO, which is less restrictive? Why? Because a PPO, you can go in or out of network. You will just pay more if you go out of network. Whereas on an HMO, if you go out of network, typically you would pay all costs unless it was an emergency or urgent care need. So maximum out of pocket is my safety net if I'm on a Medicare Advantage. It limits my out-of-pocket expenses for approved and in-network services. So if I were to look for a Medicare Advantage plan, and I should have brought my book, I'm sorry I didn't, that Medicare and You book, which I usually do bring, Medicare and You, all people on Medicare receive that book in their home. I could look at the back of the book and it would list all the Medicare Advantage plans available to me, and I could simply call those companies and find out if my doctor is in that network or not. So it takes a few more steps, but then so a person can avoid unpleasant surprises, as you said your friend did, then as long as they're educated about it and they know what to expect, then that's their choice.
Okay, and then we'll be saving money on a monthly basis because the Advantage plans are typically less money or no money to get that plan, right?
Right.
But I think what's kind of confusing too is for the Medicare Advantage, you're going to an insurance company outside that Medicare like umbrella, but it's still called Medicare. But I know it's sanctioned by Medicare, but it's not Medicare, really. I mean, it's outside of that umbrella of protection, sort of, in a way.
So if I choose to enroll in a Medicare Advantage plan, this company that I choose to enroll with, Medicare pays them to take care of my benefits because now I've decided not to enroll with original Medicare, right? And so I've decided to go with XYZ Insurance Company. So Medicare says, oh, Diane is going to go with XYZ Insurance Company, and they pay them a fee.
I see.
And then that company is responsible for supplying me with Medicare A and B benefits, although this time I use network providers typically, or if I go out of network, I pay more, but Medicare is paying them then to take care of me.
Okay.
So I still get Medicare benefits, like hospitalizations, medical services, all those sorts of things, but my co-payments and responsibilities as far as financial responsibilities are different than original Medicare.
Okay, all right. Well, I can see where if you're kind of okay with someone else, like your physician within that group, and they then recommend, I mean, I think as you get older, you might have more health issues. So you have a specialist that maybe you want to go to. It has to be recommended or within that plan that physician is in, that specialist.
If it's an HMO, it has to be a referral.
It has to be a referral, okay. A PPO doesn't have to be a referral.
Correct.
But you're going to still pay probably a little bit more than someone else would be paying if they were under original Medicare.
Well, with under original Medicare, okay, so if with under original Medicare, if I'm just going to throw a figure out there, like at age 65, maybe I can buy Plan F for $150. So I pay $150 a month to my insurance company for my supplement Plan F, and of course I have my Part B coverage too that comes out of my Social Security check or I'm being charged for. So I'm paying that insurance company to take care of any deductible co-payment or co-insurance that I'm left with Medicare. If I enroll in a Medicare Advantage plan, number one, I still have to pay that Part B premium coming out of my Social Security or I'm being billed for it. And then my Medicare Advantage costs, I don't want to necessarily say it would be more costly for me, but it could be potentially more costly for you to be in a Medicare Advantage plan because your costs for the year might be more than $1,800, the 150 times 12, versus the Medicare Advantage plan.
Okay.
Where the Medicare Advantage plan, some people say, but I might not have any costs. And they're absolutely true.
That is right.
So it's just what a person feels most comfortable with.
And I think if you feel like you're somebody who doesn't really have any health issues, you don't feel like you're going to need anything special, maybe you feel very comfortable going that direction.
A person certainly could, right? And what's nice about Medicare, Medicare period, is that, you know, with married couples, they both don't have to make the same decision. Some people may go with a Medicare supplement because that's what they feel most comfortable with, and their spouse may go with the Medicare Advantage because that's where their comfort level lies. So they can make those individual decisions. So everybody's happy.
Everybody is happy. It's just funny when you start talking to people. I mean, really, people have such strong opinions about their plan and what they get, and they're like so sold on that. And you're like, well, I don't know if that's good for me. So it really has to be about you.
It's an individual choice, for
really
sure.
Is. I mean, you can't listen to someone else's. I mean, you can listen to their experiences. That helps you make decisions. But I think a lot of times that they're so convinced that this is the way to go, whichever way it is, that you have to just go through it yourself or get help. I'm sure you help lots of people make good choices with your advice.
I like to make sure that people understand what they're purchasing. You know, so that if, you know, they're but, you know, there's a lot, so there's so much information, and I tend to talk a lot. So sometimes a person doesn't remember everything I say, but that's why there's so much help. So I may speak with someone and they say, you know, I want to learn a little bit more than what she said. They could go to Medicare.gov. That's the official website for Medicare and the only website that I suggest people visit. Medicare.gov.gov. That's where people want to go for information on Medicare Advantage plans, Medicare Part D prescription drug plans. They do have some information on Medicare supplements, but they usually refer people back to the insurance companies for that. But Medicare.gov is the official source. So that way you're not going and Googling Medicare and then you're getting some insurance company, which my clients sometimes tell me then somehow then they start getting phone calls because
that is true. You're like, what? I really wasn't, you know, but anyway.
Right.
Yeah, that is true. So go to that. I mean, it really is a very expansive website and very helpful.
Yeah, Medicare.gov, and then the Medicare and You Handbook, which is a great resource. And I always suggest to people, you don't have to read it from front to back, but if you want to learn more about skilled nursing facility coverage or Medicare Part D, just read it, because, you know, hearing about it, reading about it, and talking about it, then it starts to solidify.
It does, sinks in a little bit.
Yes.
Let's talk about Medicare Part D, which is the prescription drug plan, and people can get what's a good plan for them, but how do they know what is a good plan for me? Because there's all kinds of different things they can get involved in.
That's a good question. So with a Medicare supplement, you know, people can, you know, say, well, I have Plan F or I have Plan G, and you know, absolutely, it could work for anybody. But their Medicare Part D plan, there are 28 options in Illinois next year. Yes, well, there's 27 this year, so I guess it's only one more, but it sounds like a lot more.
It is a lot.
Right. So again, there's a few different ways people can look for their plan. One, they could look at the back of their Medicare and You Handbook, and they can see all of the prescription drug plans available in Illinois. And there's actually like 10 companies offering, each one offers a little bit more than one. Okay. So a person may say, well, I'm going to start with this insurance company. That's fine. The best way to find a Medicare Part D plan is go to the Medicare.gov website. And right on the home page, they have access, looking for a 2020 drug plan, 2020, and you can just click it, and it'll take you through the process of, you know, which pharmacies you like to use. You can input your prescriptions if you like, and of course, a person would really want to, and then it will show you all 28 plans available in Illinois. Now, for years, they used they had a software program. It was awesome, totally great. This one is almost totally great. They keep tweaking it and making it better because they changed it this year. I think they used a different vendor, or their license expired with the other company, so now they have a new software plan finder, but it's still really nice. I always suggest to people that they can sort their answers, right? You could look at lowest premium of all the plans. Well, okay, lowest deductible. But what do I really want to know? I really want to know, what are my costs for my drugs going to be? And what is my premium going to be? So under the sort option, there is lowest premium and lowest drug cost. And that's what I want to click. And then it'll show in order from least expensive to most how my drugs would be covered and what my premium would be.
Oh, that's really nice.
That really helps people. Now, what people on Medicare who have a Medicare number can do now, and this is what this new program, it's a great feature. So I could say, I want to create an account. Now, I can only create an account if I have a Medicare number, okay? So I can create an account. I could go in there and put my Medicare number, and then it will pre-populate all of my drugs that I took like in the previous year.
Oh, wow, that's
so
great.
I should look at that list to make sure it's accurate and maybe drop some or add some or change some strengths or dosages, but it will help me put that in there. And as a Medicare beneficiary, you can go in there each and every time and check it out. And then if a person wants to, they could do their research, click and look at these certain plans, because when they see the 28 plans, they'll say, oh, that one's the best for me. Click it, because then about 6 or 8 pages pop up. And I know that's a lot, right? And so people can, if they wish, just look at it a little bit and say, oh, I got this far. I'll come back and revisit it tomorrow.
Yeah,
right?
That's a good idea.
Right, because they can create this mymedicare.gov account and go back in there, and they can look and see, gosh, if I go to this pharmacy, it's this much, another pharmacy, it's that much, and this pharmacy. So it's a good educational experience.
That really is.
Right, so I've been trying to show people how to use this, because then they can, once they've done their homework, maybe called the company and found out a little bit more information, they can enroll through that way.
Okay,
Also.
but this would be, you could enroll or change this at any time.
Oh, the Medicare Part D plan?
Yeah.
Oh, no. Remember, you can only change it October 15th through December 7th.
This one you, okay, I wasn't sure.
Right. The supplements, you know, if you want to make a change with your company, always talk with them. You know, some companies, most companies have rules saying you have to answer these medical questions before we allow you to make a change.
Okay.
But of course, they can always keep what they have. But with a Medicare prescription drug plan, they can only change it during the 7-week period, or if they move out of state or some other special situation.
Yeah, but for the most part, you better look now. Because people's prescription drugs do change, you know, whether they're adding or subtracting, maybe their plan would change too, that they could.
Oh, well, that's so important, Sue, because all of the Medicare Part D plans, well, I shouldn't say all, most, you have to be careful, right? Most plans do change every year. Their premiums can get higher. The drugs that they pay, that they cover can change. They can change the co-payments for the drugs. And so if a person does not review their Medicare Part D drug plan options and make a decision before December 7th, then they might be unpleasantly surprised in January. So
Okay.
if I make a change from October 15th through December 7th, the change becomes effective January 1st.
Okay.
All right.
So you can change it now. It'll be effective on the 1st. And you do want to make sure that your prescriptions that you take are in your plan that you originally signed up for, because now you're saying that can change.
That can change. They could move to a different tier. Your co-payments could change. So all of the Medicare Part D plans have extended hours during this time period. So if a person is unsure, so if they don't want to go to this Medicare.gov website and play around with that, right? They don't want to do that. They can call 1-800-MEDICARE, and 1-800-MEDICARE now can help them choose a plan. They can say, this is the drug I take, this is the strength, this is the dosage, have your bottles out, right? And they can enroll through 1-800-MEDICARE, and 1-800-MEDICARE can help them with their plan
and
choices.
that is, I really think, so important, because there's so many people that look at a computer screen, or they don't really have the skills to get on the screen that way, and they're so confused, and it's worrisome. So if you can call someone and get that kind of help, I think that's really terrific. I know a lot of people who would rather just call.
Right, and so, and calling 1-800-MEDICARE, they're open 24 hours a day, 7 days a week. So I know most of us will say, oh, I don't feel like doing this on a Friday, I'll do it Monday morning. That's just so common. So I would say call on a Sunday afternoon, or call on a Monday evening after dinner, or Tuesday evening.
Not Monday at 9 o'clock.
No, because you know everybody. And if you do, put your phone on speaker and read a book while you wait. You know, that would be the best thing.
Just think about your timing. next thing is, so Medicare Part B premiums, they change at this time of year too?
Well, Medicare Part B premiums, the deductibles, co-payments, they do change. However, they did not release that information, and I even checked this morning because sometimes it'll just be released overnight, right? But I checked this morning, it hasn't been released yet, but it'll be released shortly.
And it probably isn't going down, right? We always hope.
Well, you never know. I mean, that could happen because Medicare supplement plan premiums can sometimes come down.
Okay.
It's not always, but they can come down. But the Part B deductibles, co-payments, and co-insurance, and the Part A deductibles and co-payments, they change, and they're usually announced by the middle of November. Yeah, middle of November.
And now, do they send you a mailing, or do they let you know, or it just changes and it's, unless you look into it, you're going to get a little bit of a surprise?
You know, years ago when the Medicare and You book would arrive in people's homes in September, the information would be in there. But that's probably 6 or 7 years ago. So now, because this information is released later, I don't really think they send a mailing out. So I know that it's reported in many of the newspapers, but I really don't think they send a separate mailing out because that would just be so darn expensive,
really
wouldn't
would.
it?
Yeah, it would.
Yeah. But you know, an insurance company, or if the people work for an insurance agent, or again, 1-800-MEDICARE, there are different ways to get all of these answers. If they don't want to call their insurance company, they could probably call Plows, right here in Palos Heights. They could call their own insurance agent, or again, 1-800-MEDICARE.
Okay, all right. Or just, would it be on their website too?
Oh, absolutely.
Yeah, okay.
Medicare.gov.
Medicare.gov, that's your friend. And that phone number is your friend. We'll put that up too, so you know what that is. Anything else that our viewers might need to know with this period of time? It already started October 15th. We are into November right now, so you need to be thinking about all of this because December 7th seems like far away, but it really isn't. So if you want to make some changes, you need to do it now.
Right, right. So, and again, you know, going to the Medicare.gov website, the back of your Medicare and You book, going to a meeting, because there's plenty of meetings. But, you know, I've heard other people say this, and I'd like to repeat it too. When people are looking at Medicare supplements and Medicare Advantage plans or drug plans, people should always remember they're buying insurance. You know, because I know that some companies will throw in fitness memberships and they make it look all so exciting, you know. But remember, what you're really buying at the end of the day is health insurance for your peace of mind, right? Just like when we buy homeowners insurance and car insurance, it'd be nice to get all those extras, and it is nice to get them, absolutely. However, we really want to look at the insurance benefits that we're purchasing.
Yes, good advice, because that's what you're doing. You're purchasing insurance to make your life run smoothly. Very good. Well, thank you to Diane. Thank you so much for coming in.
Thank you, Sue.
And Diane just has such great information, and now you can go to the website, you can make some phone calls and find out what you should be doing, or maybe you're completely happy and satisfied. But even that said, I think it's a good idea to take a look, especially when you're talking about the Part D plan and so forth. You know, that can change things for you. So I think it would be helpful.
Right. So because every year with Medicare Part D, they do get packets by the end of September. But I also know we also start to get all these fun catalogs and everything,
Yes,
right?
we do.
And so sometimes things just get like stacked.
They do.
Right? So please, if you haven't looked at your Medicare prescription drug plan changes for next year, just call the insurance company, say, I have this plan, can you tell me how it's changing? And then if you are happy with the way it's changing, you don't need to do anything.
Yeah.
But if you are not satisfied with what you have, not satisfied with the changes, then now is the time to make that change.
Okay. So get that organized, get on the computer, get on a phone. By December 7th, make your choices. And you're right, we have been getting a lot of fun catalogs.
Yes.
And I do have a stack right there. So maybe you do too, and you don't want to let that slide along. Thanks for watching us. Thanks, Diane.
Thank you.
And we will see you next time around Palos. Bye-bye.